Guys, this is Amanda, and I'm going to speak to option 2, the orientation process, for my discussion. As a nurse who's recently been hired in a hospital, I can say that I, along with everyone else, did the standard orientation, and I too understand their thoughts of feeling ill prepared to go into the workforce individually and take on the responsibility of whatever their job capacity is. Me being a nurse, for them it might be something else, but I share in those woes and those concerns of going onto the floor after orientation and feeling as if I'm ready to seize the day. I've gathered many healthcare organizations require you to do at least 2 weeks of orientation where they discuss the mission of the company, their expectations of you as an employee, sexual harassment, racial discrimination, healthcare, insurance enrollment, taxes, and things that affect the organization as a company. And then they also try to blend in your tasks and responsibilities based on the job that you were selected for. Any additional orientation to a healthcare facility will be contingent on the department in which you're trying to work, the level of expertise required to fulfill those tasks, and your proficiency with those tasks. As a new nurse with no hospital experience, I was required to work alongside a preceptor for so many days, and my caseload or my workload was contingent on my performance. If I did well with so many patients, they would continue to give me more. If I did not perform to their standards, then they would decrease my load until they felt that I was comfortable and prudent enough to handle more patients. I also had to pass off on different skills through the course of my orientation. And if those skills had not been met, I would be required to do them again. I found this method of an extended orientation to be beneficial to me as a new nurse simply because it provided me the opportunity to shadow someone, to have somebody as a support system while I learned the rules and regulations. The rules and regulations and the ways of the hospital. It also provided me with a mentor that I can reach out to should I need anything. And it also allowed me to foster a relationship with an experienced nurse who knew what I was going through, wanted to see me succeed, and was there to ensure that I got through the orientation process successfully. I furthermore believe that this method of orientating nurses to a healthcare facility or anyone to a healthcare facility was beneficial because it also provided us different modalities to gauge our proficiency. We were asked to do a lot of computer training, and while a lot of people might rush through those and click through those tests and retests, when we got to the floor and we were challenged to pass off on certain skills, it truly highlighted if we were really proficient at those skills prior to performing them on patients. And that helped in terms of gauging our proficiency and our knowledge, and also it gauged our ability to keep the patient safe before it became a legal or a safety issue. The question was asked, should there be a longer probationary period for new hirees, 6 months? And I would argue that would be highly ineffective because the probationary period is more so for the company and their desire to invest in the employee. And a 6-month probationary period actually withholds a lot of the benefits that's needed in order for an employee to feel the support of that organization. I would argue, if anything, that there should be a 6-month mentorship program, a 6 months residency program for employees so that they can feel as if they have that support, someone there to gauge their performance in a way that promotes their retention and not in a way that scares them into leaving. The goal is to foster strong employees that will feel like you're invested in them, and in turn they will invest in you.